So think of it like it's not just a reflex now you're going to need to be working on. You're going to need to be working on a lot of other activities to help undo the damage that one thing created another. So working on reflex pattern helps us because we're really going with the foundation, but so many other things are going on top of it, and we need to look at it holistically. All right. Hello, everyone. In this episode, we are going over the Spinal Galant Reflex, book number 5, Spinal Galant Reflex. In the previous episode, we went through book 1, 2, 4. Book 1 on the molar reflex, 2 is on the STNR, asymmetrical tonic neck reflex. Book 3 was on symmetrical tonic neck reflex, and book 4 was on tonic labyrinthic reflex. So today we're going to go over the Spinal Galant Reflex. This one is a really interesting reflex pattern. It is triggered by when you stroke the back of the child. So the Spinal Galant Reflex pattern, it's triggered one side or the other, but you can also trigger it on both sides. When you stroke one side, the first trigger is stroking one side of the lower back. The motor response will be a lateral, which is a side flexion of the body towards the side that's being stroked. And then you can see that. And then extreme cases, you'll see like a leg abduction, a lift to the side being stroked, and then head might turn toward the side being stroked, and hip lifts up towards the touch. If you do that, you really see that. Actually, you see a lot with kids who are super fidgety and can't sit still. If you kind of, ask them like, hey, I'm going to lift your shirt. I'm just going to do a quick screen and then stroke one side and the other, not on the spine, but on the side, you see like a twitch and a side bend. That's that. The second trigger, the stem, is stroking both sides of the lower back. So you can stroke one side, it will be lateral turn, that side. But then if you stroke both sides, there's confusion in stroking both. When both sides get activated, the brain can get confused and the body may respond by freezing or stuck response. The response might cry, show distress or emotional response, and it stimulates urination. So in babies, actually, that's what helps them go pee when they're born, when you stimulate both sides together on the back. A lot of kids, for instance, who are still having difficulty being potty trained and they have accident at night, usually what happens is they are sleeping at night and they're laying on their back and both sides are being stimulated, and then that triggers urination. So that can be something that you might see. So usually kids that, tend to be in that category, like very fidgety, can't sit still, sometimes they're having a really hard time. Why? Because every time they sit, they're so itchy, so they always look like they just fidgety. If you notice them, like they're always like this and fidgeting this, and they touch something and they always feel like comfortable in their own skin, almost. They're very tactile, defensive. When you see this reflex pattern still present, or you see this reflex pattern and behaviors and symptoms that you can check. So for a symptoms checklist, it's on page 22. You can look through our symptoms checklist. Again, you might see the other symptoms that kind of relates to that particular client. So feel free to track those as well. My suggestion is to use this as a pre and post screening to kind of get an idea of the child, and then make sure that you are incorporating some of the activities to really target and making sure that your treatment sessions are effective. So by learning more about the clients, and then of course you can have some kids that will have so many different things, and you put together a treatment plan, and then you kind of hone in, like, okay, I'm going to tackle this, I'm going to tackle that. So I look through this symptoms checklist to give you an idea whether or not it's like super affected. And of course, you're going to do an actual screen on the body. With other reflex, there are some reflexes that you can test, like screen their body, and you might not see it, but you see when they're moving, when they're playing, when they're unconsciously doing something like moving, putting things in the mouth, or like their body's flexing and extending a certain way. not being able to catch, having a pose of a reflex pattern, but when you're scaring them, you might not see. So having the symptom checklist kind of gives you an idea. It's like, okay, how are they actually functioning? How are they in their daily life? So that gives you a good idea. So this one is the simulation is in the back, the one side. When you stroke one side bend, influences so many different things. Of course, so many benefits to it, birthing process, bladder control, influences the vestibular system, auditory, and another thing specific for this reflex is pelvic mobility and bladder control. So kids who are having a hard time being potty trained, incontinence, and if you're working on those specific goals, there are actually some therapists who specialize in that area. So I highly recommend that you communicate or work with that specific kind of therapist who specialize in it. However, as an OT, you can also implement as much of activities as you can. If you can alleviate that symptom, it might be that it will go away in your session. But there are some other therapists who specialize in different areas like vision therapy, pelvic floor feeding therapist. So make sure that you work with them and not feel like you have to do everything by yourself. I think the more you have in your team, the better. So pelvic floor posture, spinal development as well, on right and left side. It helps and influences when the reflex pattern is strong in one side, because sometimes what you see is one of our side is stronger than the other. And then as much as possible, we want to be in balance, right? So we want to make sure that we are working out and have a good balance and not just have one side super strong, one side super weak. So with our kiddos, you'll see one side being stronger than the other. So you might see that ideally this is what we want, a posture. But then if it's super affected, you might see a posture like this. And then the minute you are off balance in one area, pelvis, everything else is affected. So you cannot just have one problem. The minute one thing is, even if it's like the ankle affects everything else that goes up. So it's really important to look at the entire body when you're assessing, when you're looking at your client. That's why it's important to have a good understanding of that and not just look at one thing and then just go all in and forget the entire body. So you really have to put it all together. There's several benefits, vestibular benefit, auditory processing, and so many things that this reflex pattern helps with. When the reflex pattern stays active past a certain time, though, there is a lot of challenges that we'll have. We talked about difficulty sitting still, anything that touches the back, very fidgety, tactile defensive, does not like wearing tight clothes. It has to be like a certain texture. So parents having a hard time, like they have to find a certain texture, does not like putting belt or several challenges that the child might have. Some possible scoliosis in cases where the retention is very strong on one side, meaning like scoliosis is like side bend of kind of the spine. So imagine if you're like constantly like this, it's not the retained reflexes creating it, but there's other things that happens with our body. We have fascia that holds our body. So once you get used to a posture, the reason we can hold ourselves constantly in certain posture is like there's also fascia that goes around our muscles that holds us together. And eventually, whatever you train your body, you're gonna get, right? So think of it like it's not just a reflex now you're gonna need to be working on. You're gonna need to be working on a lot of other activities to help undo the damage that one thing created another. So working on reflex pattern helps us because we're really going with the foundation, but so many other things are going on top of it. And we need to look at it holistically. But one of them you can see is almost like a side bend of the spine. And we want to work on that. Poor head control. They might prefer to stand because sitting and their back touching the back of the chair might be uncomfortable for them. Weak muscle tone, they might be slouching. Tactile issues, auditory visual skill issues, attention, concentration. This is huge. Difficulty holding still and concentrating, constantly fidgeting. You can't be focused if you're constantly fidgeting. And about, an ability to focus. Hyperactive kids, if you're constantly fidgeting, there's like a secondary effect that they will have. So you can use the movement the activities that we have here. Again, similar to other books, we recommend several options for you to use for different age and different levels. So as a therapist, it's your responsibility to kind of screen and kind of understand which one would be the best one for your child. There are some recommendations that we have while you're working with the child. You also want them to be more focused and still cooperate and focus in the classroom. So some chairs without a back support, if they have a good core strength, that is therapy ball. So this is actually really good because not only it's not triggering their reflex, but also working on their pelvic and their muscles. So it's really good to actually have one exercise, the hip movements, hip circles, and stuff that we do for spinal galant. So they have good core strength. You can recommend or have your clients sit on a ball chair. Other than that, standing up and working or on prone like this works on head control and that's good for the posture to help. So that's something that you can recommend. There are other recommendation we have there for you that you can use, different exercises you want to do. So you want to work on the movement pattern and against the reflex pattern and towards the reflex pattern. You can trigger the reflex pattern with some of the kiddos, depending on who you're working on. Make sure they use the restroom before you work with them because you don't want to have accident. A few times, the situation had happened in a session that we had to run to the bathroom really quickly, make sure they use the restroom. In your session, there are several activities you can work on. While you're working on with some of the activities, you can always modify it. So with this reflex pattern, what it does is left and right. So we were working on side bends. That's the reflex pattern. However, if you're working on something like the snow angel, right? So yes, you are stimulating the back with the movement and the child is on their back. They're working on it. But you're also working on, especially your alternating activities, you're also working on other reflex pattern that might influence the brain body connection. They might not be able to differentiate upper body and lower body, or if upper body is straightened, they might have difficulty doing it all together, right side, left side. So if that's the case, then you have to divide it up and then focus one side and the other side, and also put together a reflex treatment plan that works with the STNR and the TLR as well when they are having a hard time differentiating. One is, like let's say the upper body is extending and lower body cannot do it. And what is the reflex pattern? Okay, so sometimes we recommend go back and work on STNR, see if we can really hone that, and then go back on this one. And sometimes it works. So it depends with the child. So look into seeing when you're working on reflex, you're not just working on one thing. Now you're learning there are several reflex patterns in our body and which one is stronger. Why is this child not able to do this movement pattern? And start to kind of break it down from there and then put an activity that is appropriate for them. Do love that back crawl if they can motor plan. Again, you need to have a really good head control. So if head control is not there, this exercise is going to be really difficult and painful. So make sure head control is worked on. That's the first thing that actually a baby works like on their back first, tracking. Then after that is moving the head against gravity. So any activity that you see with head gravity going against the gravity is going to work on head control. So make sure that you're working on that. With the people who do not like being touched, if they can motor plan, they can do their own ball massage. But if not, you can also do with some kids that they cannot motor plan. You can also be the one giving them that movement, that tactile stimulation on their back. So there's a hula hoop they can do. So many different activities. This one has several advanced exercise. Of course, we're thinking about kids and little kids that you're working with. And then you can work with all the way to adults. So we have activities that is very advanced for some of the adults to work on. And for younger kids, make sure that you adapt it. But for older kids and teenagers and adults, we have activities appropriate for adults. So make sure that you incorporate those activities. And if you have any questions about it, if you want to see some of the videos, we have it on the app. Make sure to access our app and let us know how this is working out for you and what are the goals that you are targeting. and how long you've been using these activities. Ideally, you want to try a specific treatment plan for several weeks, like 2 to 3 weeks, and definitely more than 4 weeks. 4 weeks is just, if you don't see any result by 4 weeks, change your plan because you should be seeing something, at least by 2 weeks or so. With home programs and carryover, you should see some kind of improvement or change. So 4 weeks, if you don't see it, rethink and redo the treatment plan and find out what's not working. Maybe you're missing something. That's the Spinal Galant. Look at it on the app. If you have any questions, let me know for the next episode. We'll be talking about the sixth book, which is the palmar grasp, hands pulling, and back and reflex. Thank you for joining me, and I'll see you next time.